All right, good morning everyone. Welcome to support group. I love the crowd. We're gonna have to get more chairs over here someday. This is great. I'm seeing a lot of familiar faces. I'm seeing some new faces, so this is great. Remember, support group, the real purpose of support group is that you take advantage of this time and connect with people that are going through the same journey as you are. So that's the really good thing of being able to come in person. Of course, those that are far away, you need to watch it through YouTube, but the benefit that you get from coming here in person is that you get to have these conversations that people that have already gone through the journey and can tell you their experiences. I feel like we support each other so much. We get stronger, right, when we're together. The more the merrier. So I encourage people to come here in person if you can, at least visit us once every couple of months if you live far away. And I wanted to make a couple announcements. So we have our clothing closet is open. It's here in this building. This is 675 White Sulphur Road, Suite 260. That's 260. This is the Lanier Park campus. We're upstairs in the second floor, so we've got a good amount of donations already. So if you are interested in shopping for free, as you go through this weight loss journey, patience, losing the weight, it's hard to just be buying this clothes based on the weight that you have right now, and then 2 months later that clothes won't fit anymore. So that's the good thing about the clothing closet. We also accept more donations, so if you have any gently used clothes, feel free to come by here at this building anytime from Monday to Friday, 8:30 a.m. to 5 p.m. Well, let's say 4:30 p.m. We'll be here. You can come upstairs, drop it off. We're also, accepting any volunteers that are interested in helping out sorting the clothes at the clothing closet. We also have that recipe card wall, so anyone that's here physically today and wants to take advantage of those recipes, even if you're right now in a stage where maybe you're just consuming liquids because of the diet stage that you are in, you can still take them with you and just stock them up so that when you get to that point where you can eat these more solid foods, you can go ahead and have those recipes with you. All right. And also for those that are here, we have flyers of how to access our social media. We have a closed Facebook group. I know there's a good chunk of people that are here that are in the group. If you are not part of it, absolutely grab a flyer and join us. If you go on Facebook, you just have to search NGMC Bariatrics, and then you just have to answer a few security questions and just read the rules, just to make sure that it's all respectful and supporting environment, and then we'll go ahead and accept you, and you can start sharing your experiences, asking questions. I mean, that's really great resource for someone that can't make it here to support group. That's going to be your daily support group. And for those that still can make it here, I mean, that's just extra help that I think is very good. So we have the Facebook, we have YouTube Live where you can access our cooking classes. So you go to YouTube and you search NGMC Bariatrics as well. And we have videos of our cooking classes in case you weren't able to make it to one. But again, if you come to the cooking class, you'll be able to taste the food as well, so it's really nice. All you have to do is go on our ngmc.org website and you sign up for one of the classes. You go under the About section, you click Classes and Events, and then you can search for the bariatric cooking class. There will be a green button where it says register, and you just register, put in your information. It's for free, and you come and you watch either me or a guest chef do a recipe, and you'll get your recipe card, you'll get an apron, so it's a very nice experience. All right, okay, so let's go ahead and get started. Today the topic that I can't see everyone's face. Today I'm gonna stand up. Today the topic that I chose is to discuss some of the common GI symptoms that patients experience after surgery, okay? And some of these symptoms actually, some patients do experience them not only shortly after surgery, but even if they've been a year, year and a half, or 2 years, they may experience some GI symptoms, and just talking through these things with the dietitian or the surgeon, you might identify what it is that maybe you are doing when it comes to the eating plan that could be leading to some of these symptoms. So for those that haven't gone through this, hopefully this is going to be really good information so that you can prepare in case that if you do experience some of these GI symptoms, you remember this support group and you know, okay, I remember the dietitian saying that you just have to be careful with this and that. If someone here is already post-op and has experienced some of these symptoms, I would love for you to tell us, you know, how were you able to overcome that and learn how to prevent these symptoms, okay? Because, you know, I kind of lead, but I love it when you guys talk more than I do. So if you have any experiences that you want to share, then absolutely you can interrupt me, jump in, and we'll discuss it, okay? And if there's any leftover time after we go over these, what the heck is that? I'm sorry. Oh, that is so funny. I'm sorry, people. There was a squirrel tapping on the window, which I was just totally ignoring that sound. For a second, it sounded, you know how like a drop, just boom, boom, boom. But that is so funny. All right. Okay, so I'm going to start off by asking, and anyone can answer this question, pre-op, post-op. What do you think are favorable eating habits? Things that will prevent you from experiencing any kind of uncomfortable GI symptoms. Just start mentioning things. What are favorable eating habits? There's a lot of things that the surgeon and the dietitians teach you that you have small details that you have to pay attention to that will help prevent any kind of discomfort or GI symptom.
Portion size.
I'm sorry?
The portion size.
Portion size.
And then the overall quantity of the meal.
Right. Right.
One of it's called grilled instead of fried.
Yeah, grilled instead of fried. Yeah, of course. And there's actually something else that I think about when you guys mention quantity or portion size. It's not just about measuring how much, but there's something else that we teach you guys. Bite size, so very small pieces. Because if you know, and we all go through that, you know, before you start making healthy changes and you look back at how you would cut things and put them in your mouth and you're like, and it's like this huge piece of meat that you could probably just choke on, but we, you know, still do it. That can lead to a lot of GI discomfort, even if you didn't have surgery. So post-surgery, that is absolutely something that you have to keep an eye on. So what can help with having small bites?
Chewing. Thinking before you.
Yeah. So I'm hearing.
Aware of what you're doing.
Right. So thinking ahead of time, being mindful of your food choices. Where are you going to go eat? You said chewing. Oh yes. Chewing until what consistency? Oh, you guys are so good. I'm always thinking that you should run the support group.
Pardon me. What about when you use bigger plates with smaller food? You're tricking your mind if you use smaller plates with the same amount of food.
Yeah. So this patient here is saying smaller plates because you kind of trick your mind. And that way you can control portion sizes. Also, believe it or not, this might seem funny, but you can use children like size silverware. like fork and spoon and all that. So you can buy your Dora the Explorer stuff. Just have fun with that. But that really helps. You might not.
Spicy is not good. I've learned that spicy is not really good.
No.
For my digestive system.
Right. Well, and why is that?
I guess it's the acid, or I don't know, it just.
It's an irritant to the stomach lining. Yes. So remember, when the doctor or the dietitian gives a recommendation, there's always a reason behind it. Even if we just say, just do it. Don't feel like we're just imposing these rules on you. Oh, if you're curious really to understand, ask why. And anyone that you ask why, they're going to give you a reason. So the spicy foods, caffeine, those are irritants to the stomach lining. And when you have such a smaller pouch, and a pouch that has been, their surgery happened there, we want to take care of that pouch as much as possible. We want to prevent you from developing an ulcer or anything that will cause you discomfort and then make it difficult for you to have success. So sometimes I feel like us providers, we focus on the motion. Okay, here's the next patient, here's the next patient. You have to do this, you have to do that, you have to do that. Sometimes there's not even enough time to explain the why, but there's always a why behind all the recommendations that we give you. So anytime that you're curious, why, just ask, because there's always an answer.
Giselle, can I ask a question?
Yeah.
Why no beef for 6 months? Now that's Dr. Wynn, but why is that?
That's because it's the fibers from the beef are tougher to digest. From all the animal products, it's the highest in fat content, even if you choose a lean cut.
Right.
So that fat can cause discomfort, but mainly I'm going to say it's the tougher fibers for us to digest. So you want to choose, even if you crock pot it for 48 hours, it's better to be patient and take it one step at a time. And it's crazy how I've heard so many patients, actually those 6 months, I thought they were going to take forever, but they did go, when after they're in the 6th month, they're like, oh my gosh, that was actually quite fast. So, I stress patience and just think, okay, it's not a good idea to have it now, but I will have it eventually. That's a good question. It's funny because I was just saying, you should ask your provider the why. And for a second, I worried that the question that you were going to ask me, I didn't have the answer for. I'm like, I hope I have the answer for this, because that would just not be okay. All right. Well, yes, that's the reason for that. Okay. What other favorable eating habits?
Eating more often, less food more often.
And that's I'm gonna use the word controversial, but it makes it sound so dramatic. That is more based on the surgeon and the practice preference, because depending on which surgeon you work with, you might be asked to just limit to 3 meals in the day, or you might be asked to eat multiple smaller meals throughout the day. Really, it's because the research that has been done doesn't say those that do 3 meals a day have better outcomes, or those that do 4 to 5 small meals a day have better outcomes. So you could go to different states in the United States and visit their bariatric programs, and you will see differences in those recommendations. But so that's my reasoning behind that. So you could do 3 meals a day, you could do 4 or 5. It just really depends on what your team wants you to do. Okay? And I almost forgot, when we were talking about portion sizes, I also remembered it's not just about portioning your food. What have we taught you to listen to?
the first sign of, that you're satisfied or full, you stop.
And what is that? What's the sign that your body gives you?
You're satisfied, that's
Mhm.
enough, you feel like that's enough.
So there's actually a physical, like gentle pressure
Mhm.
is what most patients tend to describe it. Kind of like a pressure in the stomach pouch, and they know that they're done. I had a patient.
I start hiccuping.
Okay, that's the way that your body tells you that you've had enough.
And my nose runs.
Yes, my nose runs.
Your nose runs. That is very interesting.
Evidently it's common because in the
Yeah.
online support group that I'm in, like tons, they did a survey.
Oh, really?
Like 70% of people for the first year, when their stomach's full, their nose runs.
That is so
And it's not
interesting.
like normal nose running, it's just water.
It's
One of the fourth year,
what?
He said he's 4 years and he still does it.
That is interesting. Okay, so one of my patients is saying that that when she knows that she's full because her nose starts running water. To be honest, that's the first time that I hear that, but I've been here in this program a little less than a year. So I learn with you guys on a monthly basis. That's very interesting. But hey, I mean, if you feel that if it starts running, you know you're good and you stop. Okay?
You know, at first, it's hard to tell when you're full. It
Uh-huh.
was for me at first, and I didn't, I guess I never felt that feeling before, cause I always overate,
Yeah.
I suppose, I don't know, but at first I couldn't tell when I was full.
Mm-hmm. And let me tell you that maybe, correct me if I'm wrong, maybe you experienced that more when you were on the liquid, soft foods.
At first, yes.
Because
near the beginning.
It is harder to recognize that you're satisfied when you're eating soft foods. And that's actually one of the things that we're going to talk about today, because when you're already advanced, when you're at the point where you can eat pretty much the regular foods, we recommend patients to try and not consume a lot of soft foods because they may not feel that satiety.
That's
Uh-huh.
it.
So I'm wondering if that had to do with it initially too. When you start more on those tougher foods, then it'll be, once you start those tougher foods, it's easier to recognize, okay, I can feel that satiety. Mm-hmm. I had a patient one time that told me that she knows that she's good when her stomach flips.
Oh my God.
And I'm like, that does not sound good. But she feels like that's how she described it. And she knows that that's enough. The point I'm getting to is that we provide portion guidelines to give you an idea of how much your stomach can tolerate, but what you need to learn to listen to is that gentle pressure or the runny nose or the hiccups that tell you that's enough. I've got to stop. And this is a skill that you develop. So you won't be able to figure it out right away, but with time you develop that skill. And the only way to not override that is being what? Mindful. Exactly. Which it's difficult in a world where we're surrounded by so much stimulus and craziness and news and iPhone and this and that and children and job and responsibilities and paycheck. I mean, who wants to pay attention to their stomach, right? That's may not seem like a priority, but you guys are here because you've decided that you've committed to get into this journey and improve your health. So now that is in the list of high priorities. Communicating with your stomach. Okay? Okay. Also, of course, eating balanced meals. And that solid foods increase satiety. I already mentioned that. And what are some unfavorable eating behaviors? What do you don't want to do? And that's in the top of my list. So can you talk more about that? Can you explain what that is?
Not actually sitting down and eating an actual meal, it's sitting and like snacking throughout the day, just like every 30 minutes instead of just
Right.
doing your.
So in case you guys can't hear her, she's saying that not sitting and having small bites and snacks throughout the day. Why is that? Why is that not a good behavior, eating behavior?
Because you don't ever really get the sensation that you're full, and it leads to overeating and eventually.
You're actually going back to your old habits when
Mhm.
you do that.
Right, right. So that satiety, that gentle pressure in the stomach, you're never gonna feel it if you're just eating 1 or 2 bites of food here and there. The purpose of one of the purposes of the surgery is to reduce that stomach pouch to a size where smaller quantities of food will help you feel more satisfied, but that smaller quantity of food it's still at meal times when you're having a balanced meal with the different food groups, right? If you're just doing a bite or 2 of whole wheat crackers, for example, that's not going to make you feel satisfied. So a few minutes later, you'll be able to go for something else. So, and let me tell you, I'm not saying that you're not going to experience that desire to graze. I mean, that's normal. And I don't want you to feel bad about that. But the good thing is that you come here, you learn, so that you are mindful about these things, and when it happens, when that desire happens, or you actually catch it after you've been grazing a little bit, you can go like, whoa, wait, this is exactly what we talked about that day. That is not a favorable eating behavior, and this is going to be detrimental for my weight loss journey. So it's not a matter of you can't make that mistake, it's a matter of knowing that that's not the best thing to do. And if you see yourself doing it, you just want to jump back on what you were doing before. Okay, so no one's perfect. I think I say this in every support group. I feel like I don't want you guys to ever feel that we're expecting you to never make an eating mistake again or whatever. I mean, it's going to happen, but you just have to identify that quickly and just go back to to what you know you want to do, so that you can continue with the journey. Hello, welcome. Okay, now I'm going to talk about the first symptom, and that is called dumping syndrome, which you guys have probably heard that many times already.
Scared to death of that.
Scared to death. Oh my, don't worry, you're not going to die.
You just think you are.
You think you are, yeah. And let me tell you, even if you're being really good with your meal choices, it can happen. It can happen. So, anyone has had that experience and wants to, okay. Do you want to share any thoughts, or,
It's related to choices. I mean, you make bad choices, either related to sugar or fat content or grease.
right?
I don't know if you had specific questions, but yeah.
Mm-hmm.
Actually, for me, I couldn't, when I come out of surgery, I experienced it because I could no longer tolerate the chicken broth.
Mm-hmm.
I could only tolerate beef broth, and chicken broth would make me dump, and it
Mm-hmm.
made me really bad sick. So I had
Now,
to switch.
in that case, I'm seeing that more of a little bit of an intolerance at that
I don't know,
moment
but it was the same symptoms as the dumping.
as the dumping syndrome. Mm-hmm.
Can you explain what dumping syndrome is? Like,
Sure. So, dumping syndrome happens more for the Roux-en-Y gastric bypass patients. About 40% to 70% of Roux-en-Y gastric bypass patients experience it. The sleeve gastrectomy patients can still experience it, but not as much. The reason is, if you remember the anatomy of the stomach, the sleeve gastrectomy, you have your esophagus. When you eat, we've got this tube. This is your esophagus, which connects with the stomach pouch, which is the banana shape now. And then there's what's called a pyloric sphincter, which is a little valve that opens and closes to let food out into the intestine. With the sleeve gastrectomy, that sphincter controls how quickly the food goes into the small intestine. The difference with the Roux-en-Y gastric bypass patients is that it goes from the esophagus, that stomach pouch, and you no longer have that pyloric sphincter. The pyloric sphincter was over there, and we, rearranged, cut the small intestine, the lower part of the small intestine, and sewed it into the stomach pouch. So now there's no valve there stopping the food from going into the intestine. So when you eat, the food in its more concentrated form gets dumped into the lower part of the small intestine, and if it's very concentrated in fat or sugar, your small intestine is not used to receiving that concentrated form of food. It's used to it being digested by the stomach first, then into the beginning part of the small intestine, and then to the lower part of the small intestine. So what that causes is a lot of fluid to be drawn into the intestine. Your body goes like, oh my gosh, that's too concentrated, we need fluids. And it starts sending fluids into the intestine, and you start getting symptoms of diarrhea, nausea, dizziness, palpitations, kind of tachycardia symptoms, and low blood pressure. Those are the symptoms you may experience. So it can take you straight to the toilet, and you'll be there for a little while, and it's not going to feel great.
Within 10, 15
Mm-hmm. It usually resolves between 18 to 24 months after surgery, okay? But I have had patients that come back and see me and say, I'm still experiencing dumping syndrome, but when I look into it, it's really because they haven't been making the right food choices. So they have been choosing foods that are very concentrated in their natural sugars, and food that have a high amounts, or foods that have a high amount of fat. So it's not, after those 18 to 24 months, if you're still experiencing dumping syndrome, you need to go see the dietitian, because maybe you're just unaware of the food choice that you're making is leading to that dumping syndrome. So did I explain that clearly? Does that make sense? The dumping syndrome? Okay, excellent. There's what's called early dumping syndrome and the late dumping syndrome. So the early dumping syndrome occurs 30 to 60 minutes after a meal, and it can last for an hour, okay? And it occurs because of the reason that I said. The stomach empties out quickly, the concentrated foods go into that lower part of the small intestine, and it just triggers all that fluid, and then you get all those symptoms of diarrhea and whatnot. And the treatment for that is, based on what I've explained so far, what do you think you can do to prevent that? Mm-hmm. So another word for concentrated forms of natural sugars is the carbohydrates, which you're all, if you've been with us for a little bit, you've gotten some nutrition education on what are carbs, what are proteins, what are fats, right? So carbohydrate is just a fancy word for the naturally occurring sugars in food. So for example, fruit has its own naturally occurring sugars. So it has carbohydrates. It doesn't mean that carbohydrates are evil or unhealthy. It's just a naturally occurring sugar in the food. The key is to do a small portion size of the carbohydrates, and to choose more complex carbohydrates rather than refined carbohydrates. And I'm going to explain to you what that is. Or actually, I'm going to leave that up to you. You're going to have to answer me. What do you think, what comes to mind when I say refined carbohydrates? Sugar, just pure sugar. Yep.
Bread.
Yes. Yeah.
If it's flat, don't buy.
Yeah.
Yeah.
Unless it's cauliflower.
Yeah.
Yes, so bread comes from grains, right? And it's been completely stripped out of its fiber, the white bread. So it no longer has that fiber, which means that it's a simple carbohydrate. When it had the fiber in it, like whole wheat, whole grain, it was considered a complex carbohydrate, but they've stripped out the fiber and now it's a simple carbohydrate. And the thing is that when it doesn't have the fiber anymore, we absorb it really quickly. If it had when it has the fiber, we absorb it more slowly. Okay? I have here in the PowerPoint some examples, although I now notice that's kind of small, so I'll read it out loud. So the reactive hypoglycemia, we haven't talked about that. I'm going to talk about that. So dumping syndrome can be triggered by, for example, ice cream that has a lot of sugar and it also has fat. Sherbet, sorbet, sweetened or frozen yogurt, chocolate milk, regular pudding, regular gelatin, regular popsicles, fruits with added sugars like your canned or some frozen fruits. So what are the good choices when it comes to canned fruit?
Buy the no sugar added.
Right, in its own juice, and I would not drink the juice, strain it. But yes, what you want to avoid is the ones in the syrup, right? And there are some that are packed in water. So if you want to be extra careful about it, then you can even grab the ones that are packed in water.
Or fresh. You could eat fresh fruit.
Right, you can eat fresh fruit, but you know what? And I'm not saying this will happen to everyone, but I'm just going to tell you an experience that I learned through a patient. I had a patient that experienced dumping syndrome with bananas. And that's the fresh fruit, but bananas, because it's so concentrated in its natural sugar, it did trigger that for her. But I haven't heard that from any other patient. So again, everyone's very individual, and some people may experience it more with some foods than others. So, but I just wanted to throw it out there so that you can see how even something like a fresh banana could potentially trigger that. So the only thing is that when I talked to this patient, I wasn't actually doing the counseling. She just told me about it. And I wonder how much banana she had too, because maybe a bite or two wouldn't have done harm, but maybe more than a bite or two.
The riper the banana, the higher the concentration of sugar.
And yeah, maybe it was super ripe rather than more on the greener side. Yep. And things like dried fruit. So what do they do to dried fruit? Don't tell me they dry them. What happens to dried fruit when they're... Yeah. So the water evaporates. For that reason, the sugars are a much more concentrated form. When the water was in the fruit, it was more diluted, but now it's more concentrated. So yes, dried fruit potentially could be a healthy food, but when you've got weight loss surgery and you're worried about experiencing dumping syndrome, then maybe that's not something you want to experiment with too quickly. That's something that maybe later down the road you could add a couple to a dish
You
or something.
gotta watch that dried fruit. Sometimes they put honey on it, sometimes they put pineapple juice on it, sometimes they put apple juice on it, so you gotta watch it.
Yeah. Sometimes they just add plain sugar to it.
Yeah.
It's already more concentrated in its
Yeah,
natural
well-
sugars, and they go like, well, let's add more sugar to it. I don't get it, but yeah. Sugary beverages, of course, that's that's pure sugar. Your sugar-coated cereals, of course, any pastries that are sweet, because the sweet pastries, they not only have added sugar, they have fat, and they're made with refined white flour. So this is like triple whammy for you. But the good thing is, all this stuff, you learn this, even, pre-op, and you're very well aware that these foods are the ones that you want to stay away from to
All
prevent
got
this.
starches in them, so that's, I don't know. I'm a diabetic, so I have to watch all that.
Sugar, honey, molasses, syrups, jams, jellies, okay? Unless they're sugar-free. And then this is another one that I put up here because I thought that this is easy to maybe miss, is hidden sugars. So something like barbecue sauce that has, they add sugar to it. Or sweet pickle relish. Believe it or not, jarred tomato sauce, they add sugar to that. So if you're not careful about looking at the nutrition facts label, you may be thinking that you're making a good choice because it's a non-starchy vegetable and tomato sauce, but then you get dumping syndrome and you're wondering why.
Sugar alcohols, has anybody said anything about after surgery and how that affects them?
So I can't tell you research specifically for weight loss surgery patients, but sugar alcohols, they're not gonna cause you dumping syndrome because they don't cause they're not like real sugar. They're chemically altered so that they taste like sugar, but they're not actually sugar. The concern with sugar alcohols, it can cause gas, bloating, like discomfort if you consume too much of it. If you consume a little bit of it, if there is a couple of grams of sugar alcohol in whichever food you're consuming, that shouldn't cause you harm. But if you're having issues with bloating, gas, and things like that, and you've been eating a lot of sugar-free stuff, maybe look into the sugar alcohol content and try to keep it on the low side.
And make you kind of nauseous.
It could, yeah, absolutely.
It will. If you consume a lot of the sugar-free candy, it'll make you kind of nauseous.
So that's the deal with sugar alcohols.
You know, if you look at the jars of say spaghetti sauce, they do have it now that it says no sugar added. So I always look at the sugar content. It's tasty. I mean, it's good.
Yeah.
You just have to look for it.
Right, exactly. You can do that. You can make your own tomato sauce. I mean, you can do whichever works best for your routine. The important thing is that you look at the ingredients list. Yeah, absolutely. All right. So steak sauce, sauces at restaurants. I mean, in their menus, they can tell you maybe ingredients in like the main meals, but maybe they don't explain what's inside the sauces. So you have to be careful about that. The instant oatmeal packets, they can come packed with sugar. So want to be
They do
careful.
make sugar-free oatmeal now.
Yeah, they do. Regular or even fruit on the bottom yogurt, because of the naturally occurring sugars from the fruit and the naturally occurring sugars from the yogurt, all that together could trigger dumping syndrome for a patient. And some protein drinks, but if you know, in this journey, the dietitians sit down with you and tell you these are the guidelines, this is what you need to look at when you're choosing a protein drink. You want it to be low carb, you want it to be high protein, right? And of course, foods high in fat, such as fried foods, fatty meats, or anything that's got added fat could trigger this. All right? And then there's what's called the late dumping syndrome. And I want you guys to pay extra attention to this because this is the one that I've seen more often in patients, 24 plus months after surgery. It can happen 1 to 3 hours after a meal, and it's also known as reactive hypoglycemia. Has anyone heard about that? No? Okay, well good, because now hopefully this will be very valuable information. So reactive hypoglycemia happens when your blood sugars go lower than 70 milligrams per deciliter. But some of you are probably thinking, how do I even know that? Because I don't check my blood sugars. Some of the symptoms, if you have a very low blood sugar, less than 70 milligrams per deciliter, are sweating, palpitations, hunger, weakness, confusion, tremor. You may feel like you're gonna faint. Okay, so those are some of the symptoms for low blood sugar. In Roux-en-Y gastric bypass patients, the reactive hypoglycemia happens mainly because of the lack of that pyloric sphincter. Remember that valve that I said, which causes those natural sugars to dump too quickly into the small intestine. So what happens is that when those sugars, those concentrated sugars, are dumped into the small intestine, your body absorbs that really, really quickly and brings your blood sugars really high. So when your blood sugars are really high, your pancreas goes like, oh my gosh, I need to throw in a lot of insulin to bring these blood sugars down, because insulin is the one that transports the sugars from your blood into the cells of your body. So when your blood sugars go up really quick, your pancreas starts producing a lot of insulin to bring those blood sugars down. But what it does, it sends so much insulin that it causes your blood sugars to drop very quick. So the way to avoid this is avoid consuming foods that are very concentrated in those simple sugars. So it doesn't cause a spike in the blood sugar, tons of insulin to rush into your body, and then a very low blood sugar. Okay? And for some patients that I've seen, everyone is different, but I did know a patient that we realized that, regular white potato will do that for this patient, even after more than 1 year after the surgery. So we were just like, you know what, let's just choose some other good quality starch. Something even like sweet potato, which has a higher fiber content than white potato, can be better tolerated by a patient and not cause them that reactive hypoglycemia. Does that make sense? Okay, all right. And if in the future you experience anything like this, I think that a very smart thing to do is food journal. If you start feeling some symptoms of weakness or anything like that, maybe you don't get the whole list of symptoms, but maybe 1 or 2, and you're concerned that maybe you're getting a low blood sugar or something that we've discussed today, start keeping a food journal. Write down what you ate, what time you ate it, and write down what time you felt the symptoms and how did you feel. I mean, if you do that before you even come see the dietitian or the surgeon, you're pretty much done our job for us. We just have to look at it and be like, yep, that's reactive hypoglycemia, there you go. So we'll tell you based on the food choices that you've made what changes you can make. Okay? So if concentrated forms of carbohydrate and fats can cause these GI symptoms, what's one thing that it's important that you make sure that you eat more of? Protein. There you go. Yeah. So that's another good reason why we say protein first, so that you get your stomach pouch more satisfied with the protein, and that forces you to have smaller portions of the carbohydrates. Okay, so that helps with portion size of the carbohydrates and prevents some of these symptoms. Okay, another thing is to not eat and drink at the same time.
That's so hard, because you're so used to having that glass of water there.
Yeah.
I just have to move it away
Yeah.
to where I can't get it.
It'll take you years to say, I'm used to it. It's the truth, because if you've been drinking at the same time that you eat your entire life, then it's gonna take you years to get used to it. Used to it. I mean, you can do it, but for you to say, okay, I'm used to it, it's gonna take you years. But it's doable. It's another habit that you develop throughout your lifetime. But why do you think eating and drinking at the same time can cause dumping syndrome? Exactly. For those who didn't hear it, it flushes your food straight into the intestine, and it can trigger the dumping syndrome. Even if you've made a pretty good choice, if you just sped up the process, your stomach, that food needed to be in the stomach a little bit longer, you know, that digestive process before it got dumped into the small intestine. So you just sped up that process and you didn't allow that to happen at a normal rate. Again, there's always reasons, and sometimes multiple reasons why we recommend to do these things and not eat and drink at the same time. You don't want to get dumping syndrome, then push the mug away from you, because that can lead to that. Okay? Do you have any questions about that? Anyone that wants to share their experiences? Has anyone here experienced that reactive hypoglycemia? Well, that's good.
I
Oh.
had a kind of a time when I thought I was gonna pass out. I've had it done 4 or 5 times. The first thing I do is head for a protein diet, and it seemed to go out.
Yep. So.
That explains it.
So if that happens, even if you're, one thing that I'm gonna say is, even if you're been told that you have to eat only 3 meals a day, if you start experiencing symptoms like these, that may be a good time to eat a little bit smaller meals more frequently, at least until you're able to come visit your dietitian to discuss this. That's one thing that can help. So at that point, when you have that snack of the protein bar, you know, that helped stabilize. Yeah, absolutely. Also pairing foods that have protein and fiber, okay? Again, because fiber slows down the digestion of these carbohydrates. In the last cooking class that we did, it was the 3rd of this month, we made a grain called quinoa. Are you familiar with it? Quinoa is definitely not American cuisine.
The little black beans.
They're
The
little
black beans.
they look really tiny, like little flat discs. That the word is, they kind of pop when they cook. They have a texture to them, and they have like a nutty flavor. This is a grain, and you know that grains are mainly made of carbohydrates, right? They're naturally occurring sugars. But this particular grain is actually higher protein compared to most other grains, and it's got a good amount of fiber. So the quinoa would be a good quality complex carbohydrate that you can prepare and eat with your meals. If you've never made quinoa before, then I encourage you to go upstairs and grab a recipe card, because it does open up your options, because after surgery you're told you can't eat rice, right? So this is a good substitute, and it's got actually, that quinoa has all the essential amino acids that we need to consume. So all the building blocks for our muscles and cells and hormones and things like that. So it's a very healthy food. It's just that it's not something that we're used to, because it's not part of the American cuisine. But if you Google quinoa recipe, there's hundreds and hundreds, or thousands of recipes out there, because it's becoming very trendy because of the health benefits. Okay? You would still want to do a small portion size, of course, but it's a great one to pair with your protein in a meal. Okay? So you can come with me after the support group, and we can go check that out. Okay, we've got 3 more symptoms. There's some people experience diarrhea, or what's called flatulence. Okay, so that can happen for about 40% of patients. So if you start experiencing 2 or 3 plus soft bowel movements a day, yeah, you may be having some diarrhea there. No one likes to talk about this, but for some reason I do. Okay. Yeah.
Or you can talk about the opposite of that.
Yes,
then.
yes.
That's good.
Yes. Constipation? Yes.
Alright.
I saw a commercial where this guy is doing a cycling, like exercise class. Have you seen it? And he's like, yeah, let's get rid of that constipation. And everyone's like, no one likes to talk about it, but we need to talk about it, right? To be able to learn how to deal with it. Okay. So the diarrhea, the treatment really is drinking a lot of water because you're losing a lot of fluids when you have 3+ soft bowel movements. And one thing to check is maybe if it has to do with lactose intolerance, because there's a percentage, I can't tell you what percentage, but there's a percentage of weight loss surgery patients that develop lactose intolerance. So lactose is the naturally occurring sugars in milk, and some patients can't tolerate them very well after surgery, and it can lead to diarrhea or bloating or gases or burping and things like that. So if you're experiencing diarrhea or flatulence, then you're going to want to look into that and see if your lactose, your milk products, your dairy products are causing that. And again, keeping a food journal will help you identify that. If you experience that on days that you're eating more milk or yogurts or things like that, then it would make sense that could be what's causing it. Okay? And then chewing and swallowing slowly, okay, helps, as that helps for everything. Avoidance of chewing gum. So when you chew gum, you could swallow some air, and that can lead to
You are so cute.
Okay. And avoid gas-forming foods. But again, this is only if you're experiencing issues with this, because if you're not, you don't have to avoid the gas-forming foods. And gas-forming foods are not the same to everyone. Like, for example, here it's listed legumes. I mean personally, that doesn't do that to me. And some patients, they tell me they don't have any issues. But some patients tell me, yep, legumes like beans, lentils, things like that, it may cause them. So if you're having issues with that, then you want to maybe cut back a little bit on the beans.
Isn't that the reason you're not supposed to do straws also?
Right. Yep, absolutely. And cauliflower is a pretty cruciferous vegetable, so it's harder to digest. That could lead to some of that. So it's just something to keep in mind in case you do experience that. Constipation. Between 7% to 39% of patients experience it. And the etiology, so the cause, what's causing that, what's been seen more often is insufficient fluid intake. So that's the first thing to look into. Which can be hard for patients quickly after surgery to get in all the ounces that they need. Around 64 ounces is what's recommended, for the general population to get in enough fluids. Does anyone have issues with getting their fluids in? Okay, so that may be part of the reason. So that could get better with time. That should get better as you can drink more water. You have difficulty doing that?
I'm almost 10 months out and still having a hard time.
Okay, have you given thought to that, and have you been able to identify why?
It's just, I've tried.
Mm-hmm.
It's just hard. You just try to get it to
What's your approach? How do you try to get in the 64 ounces?
I keep my water cup. I've even tried that thing I've seen on Facebook, grab the 64-ounce bottle and mark it. It's just hard. It's just it's really hard.
I ain't had the surgery. It's hard for me to
I
get it.
carry one everywhere I go.
Mhm.
No matter if I'm at home.
And remember, your 64 ounces is since you wake up until right before you go to bed. You don't have to feel like you gotta get the 64 ounces from 8 to 5 while you're at work. I mean, the 64 ounces is in the whole day. So one thing that works for patients is getting not so much a 64 ounce mug, but more like a 30 ounce. And you know that if you fill it up twice.
I've even tried to pull myself and get a dark Starbucks cup, so I could try to drink it and not see how much I'm drinking, but it's just hard.
Did you like water before surgery or not a fan of it?
I was a fan of it before
Okay.
the surgery, and then since the surgery, it's kind of like, it just hurts. It hurts.
Gotcha. And are you doing small sips?
Mm-hmm.
Okay, yeah.
I had trouble for a little while.
Uh-huh.
It felt like it would get stuck here.
Yeah.
I could drink other things and I could eat things and they would get out, but water seemed like it hurt.
Mm-hmm.
I started buying cups of crushed ice.
Mm-hmm.
I just ate ice all day.
Yeah, and that does lead to hydration. The only hard thing about that is hard to measure exactly how much water you're getting, but you're not the only patient that has done that and has worked for.
Told to use sugar-free popsicles if I couldn't drink a lot. Eat as many as you want.
What I started doing, which is actually working out, added mint to my water and lemon, and now I'm getting in a lot more, but not.
I always thought I could have as many sugar-free popsicles as I wanted, just as long as they're sugar-free.
Yeah, that's a good idea to help with the fluids. So yeah, it is challenging, and that's one of the reasons why people may experience constipation. And then, you know, even if you get your water in, the bariatric meal plan is very high protein. There's not a lot of room for your starches, which contain that fiber. So even that type of diet can lead to some issues with constipation. So that's why each time I have a patient come see me, I show them the bariatric plate and I say, remember when you plan your meals, I know that we drill in your heads protein first, but do try to have at least maybe 2 bites of protein, 1 bite of a high fiber food, like the quinoa or beans, okay? Like 2 bites of protein, that where you are giving the priority to your protein first, but you're not waiting until you finish your chicken breast to try and eat the beans, because then you're really not going to get much and then you're missing out on that fiber. So that technique helps for some patients.
Well, if she likes bouillon, there's beef bouillon, chicken bouillon. If you like jello, sugar-free, there's always sugar-free jello too.
Yeah, you're right.
Yeah.
Those are all ways to get in your fluids. Great ideas.
There's sugar-free popsicles too.
Is it recommended for bariatric patients to use any kind of like Metamucil or anything like that? I've never heard one way or the other.
That is better to ask the surgeon. I don't think there's an issue with it, but that's a better question for the surgeon.
Dr. Wynn's nurse told me to use Miralax every
there-
day.
There you go.
You know,
Then
it's
yeah.
that, I mean, I don't.
Miralax is
know
still
what to do.
safe.
Yeah.
It's safe every
Yeah.
day. It's not like you get into the habit of, that's all you, only
Right.
reason you go. And it doesn't taste, you can put it in your water, you can't taste it.
But you do have to drink more water if you take Miralax.
Well, if it is going down easily, then yeah.
That's how Miralax works. It pulls water out of your system and puts it in your.
But yeah, if you've been told that you can have it every day, then there you go. You can use that. So yeah, hopefully this information has been helpful for you. Does anyone have any questions or concerns or anything they wanted to share with the group today?
In terms of constipation, be careful. I had to have a follow-up surgery, so I was painkillers for a while. Painkillers, constipation. So given your state of all your other variables that are already out there, if you have to take a lot of Tylenol or you're taking a painkiller or something, you're even more susceptible to it. So.
Right.
One of most of relaxers can do the same thing.
They could. That's a good question for your surgeon as well.
They do
Something
make,
to think about.
They do make opioid constipation medication, like Linzess, it's really good for that.
I kind of have a question. I'm in the beginning stages of, just working toward the surgery.
Uh-huh.
So I'm on my second month of, trying to eat properly. I'm on that phase 4. Hearing you talk about the person with the white potato, I guess it's a mindset, and I guess all of us that are here have been there. My whole life the weight's been an issue, so I think part of me, because I still fudge a little bit, part of me is trying to overcome years of eating unhealthy and making poor choices, but it's like, I think in the back of my mind I still have this thing like, well, 5 years down the road, but that's not going to happen. You've got to have the mindset that no more white potato, no more rice. I mean, that's just gone. You can't do it.
Mm-hmm.
And I guess that some of this dumping's related to that. You might think, okay, I'm this far out, I'm gonna, and it's just working on that mindset is the hardest thing I think to say. You just can't do it. So I'm curious for those that are further on out, how that's been. I guess you're just developing the habit over time. If you keep eating like you're told, that becomes the habit, I guess.
Yeah. Anyone have anything to share?
It's a struggle. It is a struggle.
But I found that if my surgery's not scheduled for the 1st, but I found that if you stop eating those things, after a while you don't even want it. But it's like everything else. If you ever take a bite, you're right back in the same place that you were. So
yeah,
that's what we were talking about. You just have to decide. That's it. You know, I'm not doing that. I've come too far. I've been through too much.
Right.
I'm not doing that anymore.
And
You're right.
And pretty much what you're saying, which I tell patients, is you have to remind yourself of the why.
Yes.
And there has to be a strong why. Why am I doing this? Why did I decide to get into this journey? And if you identify these strong whys, those tough times, those challenging times that you're facing with potatoes in front of you, then hopefully that why is so strong that it will help you make the right choice, and actually even hopefully make it easy for you to make the right choice and say, nope, you guys are not going to tempt me. That's my past. I've decided. Why? Because whatever it is your why. For some people it's spending more time with their grandchildren. For some people it's just being able to feel energy and stamina, improve self-esteem. So there's a lot of whys out there. And I tell patients don't let the number in the scale be the strongest why. There has to be a more powerful one. That number in the scale is a good motivator, but it shouldn't be the only why or the strongest why. There has to be a deeper reason, something that you can remind yourself and help you through those tough times. Because that scale is not going to help you through the tough times. Very awesome. Well, we're 5 minutes past 11, so we're done today, yeah. So yeah, feel free to mingle or whichever as I close today. Thank you for coming and participating.
So it just depends on the church. I've known how patients have been certified and those who yeah, that's the thing that that's some surgeons don't feel good about the union and some say yes. You're right. Because it's the whole thing. With that information, but I can get it for you if you're waiting for the I can get
He's awesome. not good. I have this car, still have a car, they're saying that Medicaid said they're not gonna approve it. They said that, he doesn't, fit the category, is not necessary, whatever, but his pulmonologist says he has to have it or he's gonna die. So, now they're gonna try another company.
The reality is that we're trying to get,
So, Aircare says that he doesn't fit the criteria. So, now he's got to go through all the tests. So this is set up for Monday. Then he's gonna go through, no, next Wednesday. Monday he's got to go through a nerve induction test because it's been used to receive including and feels like you're breathing on.
that's what they need. Yeah.
Well, you know, you got to have certain codes to put in. We're taking all time. You've got to put it down to 65. They don't approve nothing. That's not right.
Yeah.
I had to go to Midland.
Yeah, just bring it. Because there's definitely someone that yeah.
David wants to see Mama.
And they say the reason
They're not going to see Mama. I have Eddie's medicine before he died. I'm tired of this crap. He can't talk to himself. He can't read or write. And I got his medicine. I told Brian, I'm sick and tired of this crap. They're going to do something. I'm not leaving until they do. So, you know, I said, here I am on 210. Thank you. Get in and out of the car or whatever. It's pretty good, but I'm going to the office. I'm tired of it. And I told him, I said, let's go to the doctor and sign a paper track.
So this morning, I was like, I need to do
On the
something
phone,
really.
off the phone, in the office, whatever.
A meeting and you have one thing.
Thank you. You're welcome.
I'm brazen, and that's what it is. I'm brazen
Okay.
because I'm not used to this routine.
Yeah.
I was working Monday through Friday, 8 to 4. I'm not doing any of that right now.
Yeah.
And we're not even in a home yet, that's the hustle. I'm writing. I'm not doing the proper thing.
Did you sign in?
I just did.
Okay, good.
Thank you so much.
You're welcome. Thank you, you too.
Let's check how I don't care what it takes. I'm going to wander. I don't care. I'm just sitting here wanting to die. They don't do something. That's it. Yeah, I just want to sit there until they, you know, smart enough. People out there that gets totally. I know. You know, we don't have Medicaid, we should have Medicare and Medicaid both. Why doesn't it? And the laws. That's not your money. No. Yeah. Medicare and Medicaid both, and they're getting checks and whatever, and they're getting used as checks because Tab went back to work, she got hurt, and she's out of work, checking up. Now she went back to work, and they're saying that the checks were $700 something a month down to $78. Yeah. And they're not getting food stamps now, and and the necessities, because if I didn't, I don't have anything. I don't have food banks, or, they wouldn't make it. No. They would have no food, for nothing. How can they do that? How can they live with themselves like that? They do. I don't understand how they were sick. I know. The food stamps all the time. And